Addressing education and care gaps in tracheostomy management, insights from a multi-stakeholder global survey. This is a survey that was done by the Global Tracheostomy Collaborative, and it's been featured on their website a couple of months ago. And I'm still doing a multi-part series here because it's quite a long survey. So thank you to the Global Tracheostomy Collaborative to put that survey up here on their website. It's a long survey, and I've been dissecting it sort of section by section, and offer solutions for tracheostomy care in the community, which is what we are doing at Intensive Care at Home. Because whilst it's a good survey, it doesn't really offer any solutions. It doesn't really offer on or focus on quality care, especially in the community when it comes to tracheostomy care, which is what we are doing here at Intensive Care at Home. So in the last video, I was talking about the affordability, or the survey was talking about affordability of tracheostomy care in the community. Again, we have all the answers to that because our service is affordable, because we're cutting the cost of an intensive care bed by 50%. No other service can do that. And that's why we have a solution to everything, including we have the same workforce that an ICU or a hospital has, because we exclusively work with critical care trained nurses. So let's discuss today the affordability further. And I will also link to the survey, of course. So let's discuss the affordability and the study itself further. And what I'm reading out here is from the study. So the study identifies critical gaps in tracheostomy care. And when the study identifies that, we've identified that gap since 2013, which is why Intensive Care at Home exists. Takes the Tracheostomy Collaborative, 12 years to put a study out like that. If you set your foot anywhere near an ICU unit, you could see the gaps regardless. So, better late than never. We've identified the gaps, and we've got solutions for everything here at Intensive Care at Home. So the study identifies critical gaps in tracheostomy care, emphasizing the need for systemic improvements in workforce competency. Once again, that's what we've been doing since 2013 at Intensive Care at Home with critical care trained nurses. Access and affordability. Again, we've been doing that since day one, cutting the cost of an intensive care bed by 50%. Teamwork. We have a team working together. We have highly trained, highly specialized critical care trained nurses in the community that deliver evidence-based care. And of course, we have patient empowerment. Well, that's our whole driver. We're empowering our patients to leave intensive care and go home. So again, guys from the Global Tracheostomy Collaborative, better late than never. We've identified that way back when. Despite the life-sustaining benefits of tracheostomy, significant challenges persist in delivering safe, equitable, and effective care. Again, I disagree there. Challenges persist, I agree with that, but delivering safe, what we deliver is safe. We exclusively work with critical care trained nurses. If anything, we employ hundreds of years of critical care nursing experience combined in the community. No other service provider has a higher skill level or can offer a higher skill level in the community than we do. Equitable, what we do is very equitable. We offer this to all patients, from all walks of life, and still cutting the cost of an intensive care bed by 50%, regardless of which walk of life that people are joining us from. And our care is effective. Of course, it's effective, right? People are at home, cutting the cost of an ICU bed by 50%, and hospitals and ICUs have an empty bed. Win-win situation, and the funding body can slash the cost of an ICU bed by 50%. It's a win-win situation. So the survey continues. These gaps reflect the multifaceted nature of tracheostomy management, which spans diverse professional roles and care settings, often requiring collaboration among multidisciplinary teams. The findings emphasize the pressing need for targeted interventions to address these barriers, ensuring that patients, care partners, and healthcare professionals are adequately supported in managing the complexities of tracheostomy care. Again, we've been doing that since 2013, and we have solutions for whatever this survey is addressing here. Tracheostomy care strategies must align with local circumstances, including the patient volume and specific characteristics of the healthcare settings. I disagree there. Most patients are in ICU with a tracheostomy, and they can go home. And that's what we've been doing, irregardless of location. Some locations are easier than others, of course. Some locations service delivery is more expensive than in other areas, but again, that's all doable. We've been showing that we are the proof for it. Small community hospitals with lower patient census, for instance, may rely more heavily on champions to prioritize competencies in high priority skills among health professionals involved in tracheostomy care, whereas large academic centers may have infrastructure to support more comprehensive tracheostomy expertise and staffing. I agree with that. Differences in care settings reflect the importance of adaptable care models and resource sharing initiatives to support facilities with limited capacity for maintaining specialized tracheostomy care teams. From a hospital perspective, I argue that is correct. As a result, scalable models of education and mentorship should be developed to equip smaller hospitals with essential skills while leveraging larger centers for specialized consultation and training opportunities. Yeah, I agree with all of that, but at the end of the day, get people home. As soon as a patient is stable, even in ICU, you can get them home with intensive care at home, and what we're delivering is evidence-based. You can look up our evidence-based mechanical home ventilation guidelines on our website at intensivecareathome.com, and you will find that the evidence-based mechanical home ventilation guidelines give the framework how to safely look after ventilated and tracheostomy patients in the community with critical care trained nurses, because that is the gold standard and it's evidence-based, right? And that's what we're doing here at intensivecareathome.com. So with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. We're providing tracheostomy care, home care services for patients on non-invasive ventilation, such as home BiPAP, home CPAP. We're providing services for home TPN, also known as total parenteral nutrition, which is also known as IV nutrition. Also, home IV potassium and home IV magnesium infusions, IV fluids and IV antibiotics. We're providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families instead of staying in an intensive care unit. With intensive care at home, we're currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, DVA, Department of Veteran Affairs, all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care home nursing in 2025. We have been achieving this level of accreditation since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. If you are at home already and you're watching this, or you're stuck in an ICU, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you're living in an ICU, I'll give you a very tangible and real-world example today. One of our first clients, when we first got started in 2012, was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a ventilated and tracheostomy client. That is dangerous and it's negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at risk of dying if they don't have a team of critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it, in an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in a home care environment in the community? So this client found out about us eventually, and the ICU that he went back to all the time also knew about us and eventually reached out to us, and we were proving our concept with this client very fast. When we worked with this particular client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home, and help you with keeping you at home predictably. Otherwise, we wouldn't be in business. The same is applicable for those stuck in an ICU, similar to this case study that I've given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDI support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management in Victoria. If you're an NDI support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. And if you need more evidence for nursing care, we're also writing nursing assessment, NDIS nursing assessments with legal nurse, critical care consulting nurses. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined, and you can join this high-performing team. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury-Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again, because they are so vulnerable and so special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts, and you're really keen on building solid relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. If you are a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecarehome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecarehome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecarehome.com, and I will talk to you in a few days. Take care for now.